Hi, everyone. I have Dr. Christine Sapienza here with me today. She is an expert in the field of respiratory muscle strength training. And Dr. Sapienza, would you tell us, please, what is the difference between a pressure threshold device and a resistive training device?
Yeah, thanks. So, in the strength training device literature, a pressure threshold device has a one-way spring valve in it, which means that it's calibrated. It will have a pressure range on it. And the user will know that if they dial in, let's say, Jenny, 30 centimeters of water pressure, that valve will not pop open unless the patient generates 30 centimeters of water pressure. So it requires the muscles, respiratory muscles, to be activated, whether it's a negative 30 or a positive 30, in an inspiratory or an expiratory manner. So calibrated pressure threshold, you're setting the threshold on the device that you want your patient to enact with a muscle activity, right? And it can be negative or positive pressure. Resistance devices are just, they're typically devices that have narrowing orifices, or think of it as tubes, right? An orifice is just an opening, and they can go from very small to a little bit larger. And you're talking like, in millimeters of size inside of these devices. They typically have a dial that might go 1, 2, 3, 4, 5. When you're changing that dial, it's changing the size of the orifice. And so that is just giving you a narrowing tube to breathe through. And what can happen with that is you can't control as much, well, or really at all, your patient's starting and ending lung volumes when they operate on that device. And you also, importantly, can't control their breathing rate. So imagine if somebody put their hand over your nose and mouth. I mean, the first thing you do in the face of resistance is you slow down the breathing rate. And so when you slow down the breathing rate, you're going to get a much different training effect with a resistive device than you will with a strength training device. So they're really two different devices. And, I think obviously I have a little bit of knowledge about why I'm biased towards pressure threshold, is because it's much like what we do in the strength training paradigm for physical therapy. We lift a weight, it's calibrated, and that we have to be strong enough to be able to move that weight, with our limbs, or with our arms, or with our legs. Same thing for pressure threshold.
Thank you so much for explaining that.
You're welcome.